Did you know that once you turn 50, there is a silent change taking place inside your body that is practically inevitable for most men? Many believe that loss of potency or urinary difficulty are just signs of old age, but the truth is your prostate is undergoing a biological transformation that could dictate the quality of the next 30 years of your life. Ignoring this process now isn't just a risk, it's a guarantee of future problems that could be easily avoided with the right information. In this video, we're going to unravel exactly what happens to this vital gland the moment you cross the 50-year line and, most importantly, how to distinguish what's natural from what's dangerous. If you want to avoid emergency surgeries and sleepless nights running to the bathroom, you need to understand the mechanics behind this organ. Stick with me, because what I'm about to explain regarding its growth will completely change the way you view your own health as a man. Right after 50, and often even before, a phenomenon called benign prostatic hyperplasia occurs, which is basically the natural growth of the gland. Imagine that your prostate is like a small walnut wrapped around a straw, which is your urethra, where urine passes through. Over the years, this walnut starts to grow and can reach the size of a lemon or even an orange. This growth compresses the urethra channel, narrowing the passage and forcing your bladder to work with much more pressure to expel liquid, which causes progressive wear and tear on your entire urinary system. It's crucial to understand that this growth is benign, meaning it's not cancer, but it is a progressive condition caused by the multiplication of prostate cells over the decades. The great danger is that this process is slow and treacherous, causing you to get used to a weak urinary stream without realizing that your bladder is suffering irreversible damage. Now that you understand the physical mechanics of the problem, we need to talk about the first clear sign your body gives you, which many men ignore until it's too late. If you want to keep receiving direct, no-nonsense information about men's health, go ahead and hit the like button down below and check if you are subscribed to the channel, as this shows the algorithm that this content is relevant to you. One of the most classic and annoying symptoms of this phase is nocturia, which is the need to wake up several times at night to urinate, completely fragmenting your sleep and rest. This happens because, with the enlarged prostate compressing the urethra, the bladder never empties completely, always leaving a residue of urine inside that causes it to fill up again much faster. Furthermore, the bladder becomes hypersensitive due to the excessive effort it makes during the day, sending false signals that it needs to be emptied even with a low volume of liquid. The impact of this on your quality of life is devastating, as the lack of restorative sleep lowers your testosterone, increases stress, and affects your energy for the next day, creating a vicious cycle of poor health. Many men think that waking up 2 or 3 times is normal for their age, but this is a red flag that the obstruction is already at a level requiring medical attention. But the worry doesn't stop at sleep. There is an even greater fear that haunts men in this phase, which is closely linked to prostate health. There is a huge myth that having an enlarged prostate directly causes sexual impotence, but the relationship between these two things is a bit more complex and involves nerve anatomy. The prostate is located right next to the nerves responsible for erections, and although benign growth itself doesn't sever these nerves, severe urinary symptoms and poor quality of life can tank your libido and erectile function. When you are worried about where the nearest bathroom is or exhausted from not sleeping, your sexual performance is the first thing your body sacrifices. Moreover, the fear of treatment often paralyzes men, because in the past, prostate surgeries had higher rates of affecting erections, something that is much rarer today with new technologies. The truth is that treating the prostate early can actually save your sex life, as it restores your confidence and eliminates pelvic discomfort. However, to treat it correctly, you need to know how to differentiate whether what you have is just benign growth or something much more serious that is also common after 50. It is fundamental to distinguish benign hyperplasia from prostate cancer, as they are two distinct diseases that can actually coexist in the same patient without one causing the other. While hyperplasia grows in the transition zone of the prostate, which squeezes the urethra and causes symptoms early, cancer usually develops in the peripheral zone, far from the urinary canal, growing silently without giving initial symptoms. This means you can have a perfect urinary stream and still be developing a malignant tumor, which makes annual screening mandatory. Many men reassure themselves thinking that because they have no difficulty urinating, they are cancer-free, but this is a dangerous trap that costs the lives of thousands every year. The biology of cancer involves aggressive cellular mutations, while hyperplasia is just the proliferation of normal tissue, but only specific exams can tell what is happening inside. And speaking of biology, there is a hormone that is the major fuel for all these changes, and you need to know about it right now. This information about the difference between the diseases is vital and could save the life of a friend or family member. So share this video right now and take the opportunity to subscribe, ensuring you're always one step ahead when it comes to your health. Contrary to popular belief, it is not excess testosterone in the blood that causes the prostate to grow, but rather its conversion into a superpotent hormone called dihydrotestosterone, or DHT, inside the gland itself. After age 50, even if your testosterone levels drop in your blood, the concentration of DHT inside the prostate remains high and continues to stimulate cells to multiply endlessly. It's a paradox of aging. You lose muscle mass and energy due to low systemic testosterone, but your prostate continues to get the green light to grow. Understanding this mechanism is the key to many modern treatments, which work precisely by blocking the enzyme that transforms testosterone into DHT, breaking the gland's growth and reducing its volume over time. Without this hormonal knowledge, it's difficult to understand why certain medications affect libido or why hormone replacement needs to be done with caution and strict urological monitoring. And to monitor all of this, there's no way around it. We need to talk about the two tools every man must face without prejudice. The digital rectal exam and the blood PSA are complementary and irreplaceable, as each sees a different part of your prostate health that the other cannot detect alone. PSA is a blood marker that can rise in cases of cancer, inflammation, or benign growth, serving as a warning sign, but it is not perfect and can fail in some cases of aggressive tumors. The physical exam, on the other hand, allows the urologist to feel the consistency of the gland, if it is hard, has nodules, or is just enlarged and elastic, something a blood test would never show. Prejudice against the digital rectal exam is still a cultural barrier that kills, as the procedure lasts less than 10 seconds and offers immediate information that can define the urgency of your treatment. The combination of these two exams after age 50 or 45, if you have a family history or are Black, is the gold standard to ensure you aren't caught off guard by advanced disease. But beyond exams, there is something you can do every day in your kitchen to shield your prostate against time. Your diet plays a fundamental role in prostate health, and studies show that foods rich in lycopene, such as cooked tomatoes and guava, have strong antioxidant action specific to prostate tissue. Additionally, pumpkin seeds are rich in zinc and phytosterols that help modulate inflammation and may slightly aid in reducing irritating urinary symptoms. Keeping your weight under control is also crucial, as visceral fat increases systemic inflammation and converts more testosterone into estrogen, worsening the hormonal environment for the prostate. On the other hand, a sedentary lifestyle and excessive consumption of alcohol and caffeine irritate the bladder and greatly worsen the sensation of urinary urgency for those who already have an enlarged prostate. Adopting a physical exercise routine improves pelvic circulation and helps keep hormones balanced, acting as a true protective barrier against the rapid advance of hyperplasia. If symptoms appear even with prevention, don't despair, because medicine has evolved greatly and today's solutions are fantastic. I post valuable tips like these every week to help you live better, so to make sure you don't miss any new content, confirm your subscription to the channel and turn on the notification bell right now. Nowadays, having an enlarged prostate doesn't necessarily mean going under the knife. The first line of treatment usually involves medications that relax the prostate muscles to facilitate urine flow. There are also drugs that shrink the gland over months, and the combination of these drugs returns quality of life to the vast majority of patients without the need for invasive intervention. The main goal is always to preserve bladder function and prevent it from permanently losing its contraction strength. If medications don't work, current surgeries are minimally invasive, using high-power lasers, water vapor, or internal scraping that allows for discharge on the same day or the next, without incisions in the belly. Techniques like laser enucleation remove only the overgrown core of the prostate, leaving the capsule intact and resolving the obstructive problem definitively with a very low risk of bleeding. Technology has transformed what used to be a painful post-op period into a quick recovery, allowing you to get back to your normal life in no time. Reaching 50 with a healthy or controlled prostate is totally possible if you replace fear with information and negligence with proactive attitude. What happens to your prostate is an expected biological process, but urinary suffering and serious complications are optional and depend on when you decide to seek help. Don't wait for the day your urine stops completely to look for a urologist. Prevention and early treatment are the keys to maintaining your virility and independence. Remember that your health is your greatest asset, and taking care of your prostate is taking care of your longevity with dignity, allowing you to enjoy maturity without physical limitations. If this video cleared up your doubts and gave you direction on how to act from here on out, do your part. Leave a comment down below telling me if you've already done your checkup this year. I really want to know, and don't forget to subscribe to strengthen our community of men who take care of themselves.